Hi, I'm Chris Burns, CEO and Managing Director of Ampli Therapeutics, and I'm excited today to present data from our recent analysis from the AACR trial in pancreatic cancer. This data has been presented today at the annual meeting of the American Association of Cancer Research by our Director of Translational Science, Dr. Terry-Ann Koch. The data describes recent analysis from the AACR trial. Importantly, the data has been derived from an independent, blinded review of the clinical data, which is shown here on this slide. Most importantly is the safety and tolerability of namafotinib. As shown on this slide, in the light blue column, the adverse event profile for namafotinib and the chemotherapy in the AACR trial is very similar to that seen for the chemotherapy alone in two other very similar trials. This shows us that namafotinib is not adding additional burden to patients. And as shown on this slide, the adverse events we do see that can be related or can be possibly related to namafotinib show that those side effects are mild to moderate and are typically seen in many pancreatic cancer studies: nausea, vomiting, and diarrhea. The data we're really excited about is the efficacy data shown on this slide. Most notably, from 64 patients, we've seen 5 confirmed complete responses. So this is showing the total loss of tumour for 2 months or more in 5 patients. That's a response rate of close to 8% of complete responders. We've also seen a very good partial response rate, so responses where tumours have shrunk by more than 30% in 18 patients. And if we look at combining those numbers, we're seeing an objective response rate of 36%. In fact, it goes to 42% if we also include unconfirmed responses. So these are really great response figures. We've seen a disease control rate of 70%, which compares very favourably to chemotherapy alone at 50%. And finally, we've had 12 patients who've been on study for more than 12 months, including 1 patient who's recently completed 2 years on study. As we move on to the next slide, what's shown on this slide is each bar represents the response of a patient. And what you can see here is the vast majority of patients see a shrinkage in their tumour. Many of those patients seeing shrinkage in their tumour of greater than 30%, which is really significant. And of course, the patients in purple are those patients that have shown complete response. So I think this is a really nice graphical representation of how well the drug's working. On this slide, we present the overall survival data. So firstly, we can see in the AACR study, the overall survival is 11.1 months, which is more than 2 months improved on our benchmark study, the MPACT study. And it's also improved upon a more recent clinical study of the chemotherapy alone. So that's very promising data. What's shown on the right is a really interesting analysis looking at patients comparing stable disease patients, SD, partial responders, PR, and complete responders, CR, showing a trend to increasing overall survival for each of those patient groups. We move on to the last summary slide, which clearly shows that we're ticking the 3 important boxes. 1, we're showing a good, deep, and fast response to the chemotherapy when it's added on top of namafotinib. 2, we're showing a sustained response where we're seeing this prolonged overall survival, and indeed a number of patients who've been on study for extended periods of time. And thirdly, we're showing demonstrated safety and tolerability for the combination of namafotinib and chemotherapy. So together, very promising data. I want to finish with an acknowledgement slide to acknowledge all the principal investigators who've been involved in the study, and indeed all the clinicians and support staff at the hospitals who've run the study. And finally, thank the patients who've been involved in this clinical study and their loved ones and families. Thank you for watching.